What's interesting about GLP-1 agonists versus the injectable medications we give for fertility treatments, which are primarily gonadotropins, we give other medications as well, but they are similar types of injections. So the needles are really small, they're subcutaneous injections. So if you're somebody who's a little bit fearful of the needles for the gonadotropins for fertility treatments, it's a really similar experience to injecting GLP-1s. The other really interesting thing to note about it is that for fertility treatments, what we're primarily administering are peptide hormones. So most people don't even know this, but your FSH, that's a peptide hormone, just like GLP-1 agonist is a peptide hormone. So it's a hormone that is signaling an action at a target organ. In the case of fertility treatments, when we're giving FSH, which stands for follicle stimulating hormone, that is the main drug that helps to recruit your follicles, aka containing your eggs. So it helps recruit your eggs that we could eventually retrieve during the procedure.
As a fertility doctor, one of the biggest mental hurdles that we have to help patients get over is the idea of injecting themselves with a medication. Now, I remind patients all the time that they come into our office healthy, and hopefully they leave our office healthy too. But going through injections on a daily or multiple times a day basis can make patients feel both scared and sick, right? Because all of a sudden now you're medication dependent and you're injection dependent, and injections hurt. With that said, fertility doctors for years have been helping to coach patients on how to get over what's a very natural phobia, a phobia of pain. What's also interesting to me is that many patients don't have a fear of the injection itself. They have a fear of the administration. They worry that they're going to do it wrong. They worry that they don't know how to take the injection, how to mix the medication that's going to be injected, how to actually dispose of the needles after the injection, and how to do this in both an aseptic, which means sanitary or clean way, and an effective painless way. And that's where we actually say to them all the time that with proper coaching and other tools and resources, we can help almost anyone go through fertility treatments, which means if anyone can go through fertility treatments, anyone can go through self-administration of a GLP-1.